When should my child be seen for an orthodontic consultation?
The right time to bring a child to the first orthodontic consultation will be 7-year-old. I know it sounds a little bit early, and many dentists and parents think that they should bring their child when they have all the permanent teeth, but this is actually a mistake for some reason. Because once some children only have their permanent teeth later than the average, and also we have so many problems that can be solved and can be prevented if we will start treating them early. We can prevent impacted canine if they're viewed by an orthodontist early. We can prevent problems of the jaws, for example, on class 3s, which means that the upper jaw is a bit backwards or the lower jaw is a bit forward. We can start the treatment at the age of 7 and maybe prevent later on the need for jaw surgery. And the treatment is very, very simple, and usually the treatment are quite short as well. Second example, we have many children that are sucking the thumb or a dummy for a very long time, and it's a habit that is very difficult to stop. And just by placing an appliance that will stop the habit, and we will correct, because usually it's involving with a very narrow arch and as well as a displacement of the lower jaw because of this. So just by putting an appliance very simply within 3 months, this can be corrected, can avoid having problems with the jaws later on, can avoid more crowding, and of course stop the habit. Another example is sometimes some children have supernumerary teeth, means that they have an extra tooth that is preventing the front tooth to erupt. And we need to assess this very early and then allow that tooth to come into place. And so it needs a little bit of help to come into place. So definitely not bring the child at the age of 12 or 13, because there might be problems. So 7 is the age, and most of the treatments, the interceptive treatment will be at between 8 to 10. Very simple treatment to prevent very big problems later on. Another point that I want to also state is that sometimes we'll just review the child and we refer them back to the dentist to, let's say, remove some baby teeth to also avoid problems. So it doesn't necessarily mean that they will have an active orthodontic treatment, but they will have a specialist that can review the right timing to do what. Because we always look at the development of the jaws and of the teeth. For example, if a child loses a lower baby canine very early, then it's very important to remove the one from the other side to prevent all the teeth to shift.